Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to show you a real simple way to improve your walking after knee replacement surgery. Before I jump into that, hit that subscribe button, turn on the notifications to catch all of our latest videos. So when it comes to walking after a knee replacement, there's a couple different reasons why we really struggle and don't quite walk how we normally would. So one of them, a big one, is pain and feeling of instability and weakness in the knee and the leg. So what that means is when we go to stand or put our weight through that surgical leg, for example my right leg, we really don't feel comfortable. So what happens is we try to take a quick step and try to get off of that leg as quick as we can. So instead of taking a nice big step forward and then taking a nice big step with the other leg, we try to take a real quick step to get our weight off of that surgical leg because it's uncomfortable. And what happens is then we take these real short shuffling steps, or it might be uneven steps, and with those short and small uneven steps comes very slow walking and very slow steps as well. Now there's other issues, things such as range of motion, so being able to bend and straighten the knee through the full range of motion that is needed to walk after surgery. And that will come as you continue with your rehab and doing your range of motion exercises and build up your mobility in the leg. And also the strength will come as well. But what we really want to do is build confidence in putting your weight onto that surgical leg. So a great way I like to do that is through the use of an ankle weight. So I'm actually going to take an ankle weight and I'm going to put it on the non-surgical leg. And what I always recommend is get the heaviest weight you can. If you only have light weights, like 2-pounders, or put multiple on your leg. So now I'm putting this on the non-surgical leg. And the reason for that is now when we go to swing, I'll turn around here. So when we go through the swing phase of walking or taking a step, now we have to use increased effort, increased time to swing that non-surgical leg forward and step down. Which means by doing that, we're forcing ourselves to stand on your surgical leg for just a slightly longer duration than you would want to. So what that's doing is we're starting to kind of subconsciously or almost trick your body to putting increased weight and increased time standing on that surgical leg as you walk. So all you're going to do, you put the ankle weight on and you're just going to walk. And you can do this when you still have a walker. You can do this while using a cane as well. That's perfectly fine. But all you're going to do is walk with that ankle weight, trying to walk as normal as possible, nice equal steps. And it may not feel too different. You might just feel the weight of it. You might not notice anything with the other leg. But kind of what we're doing is just tricking the body to put that extra few seconds of weight on your surgical leg when you're standing. And so what you'll notice and what you'll want to do after you walk for a little while, a couple minutes, doesn't have to be too long, you can take this off and then just practice walking without the ankle weight on. Over time, if you do this a handful of times or even more would be better, you'll start to notice that you're able to put weight and tolerate putting weight through that surgical leg for a longer duration. And you'll just notice that your step length will start to increase almost kind of naturally. So great simple trick to kind of trick your body to get more comfortable putting weight on that surgical leg. Increase your step length so that they're more equal and larger, more normal step length as well. One real last thing, when it comes to walking after knee replacement surgery, I tell my patients think big, think brisk. So big movements and also walk with a brisk pace, a little bit of speed. Doesn't have to be rushing, but a little bit of speed walking a little bit at a brisk pace, what that kind of does is just subconsciously, you might notice, try it yourself, if you try to walk, just walk 50% faster than you normally would, is your body just naturally is going to take bigger steps and bigger movements. So big movements, brisk pace, and you'll just notice naturally those improvements in the step length, the equalness of your step length, and your walking pattern. So I hope this gives you some helpful tips, some real simple cues, and real simple exercise to improve your walking and movements after knee replacement surgery. As always, please be sure to leave your comments and questions. Please be sure to hit that like button to spread this video to other viewers. And again, please be sure to subscribe if you don't already. Thank you for watching.